baby. It could be very subtle, like lip smacking, or you could see them cycling, like a limb, upper limb or lower limb, just moving like this, or boxing, or just holding their hands in a fist. That's for a younger child. For an older child, sometimes they could have what we call an absent seizure, so they could just be staring straight ahead, and you talk to them and they wouldn't respond. Sometimes there could just be some form of eye deviation, or what we typically
they look elsewhere.
So they just seem to be looking, at different sides. Okay, then we have what we usually see, like someone just stiffening up or shaking or probably foaming, or like with the gnashing of their teeth together. So that's like an overt form of that. But we have certain subtle movement, like even with the tongue, there could be certain tongue movements that might be difficult for someone to tell that's a seizure. But like with a trained eye, we could tell that, that's usually in the younger infants. You could see certain movements with the tongue and tell that. Even with the infant, sometimes how the cry sounds like. So you could have a baby crying and the cry sounds so shrill, and it could tell us as clinicians that this baby is having a seizure.
So the watchword is to be very watchful to see things
because some parents actually are able to tell that there's something wrong with my child. This is not how my child usually cries. Or, that's for the subtle ones. Otherwise, it's what we usually see: stiffening, shaking. Those ones are quite overt, and it's easy to pick up on that there's something actually going on with this child.
Okay, how common are febrile seizures in children?
So it's one of the most commonest cases that we see, especially at our emergencies. It's very common. Like, I think about 1 in 100, if you take 100 children, at least one of them would have had a febrile seizure. Yeah.
How long do these seizures last?
So it sort of depends on the type of seizure it is. Every seizure is different. We have what we call a simple seizure or a complex seizure. So if it lasts less than 15 minutes, then it's a simple febrile seizure. If it lasts more than 15 minutes, then it's a complex febrile seizure. They have different ways they present. Like a complex one will just be focal, like one side of the body, but the simple one will be seen like the entire body. Then we also have status epilepticus, so that's when the seizure goes on for more than 30 minutes. So there's nothing really to determine that this person is going to have a seizure for 2 minutes, 1 minute. Some can just have a seizure for 30 seconds, but it can go as high as 1 hour, and then without intervention, they could still be having a seizure.
What should a parent or caregiver do when they realize that their child is getting, from what you said?
Okay, so I think the first thing is to ensure that the child is safe. So you need to put the child in a flat surface, like it should be soft, not like something hard, because they're going to be moving and they might hit their head or cause some form of trauma.
So cushion or a mattress?
So like a soft mattress, like on the floor, not up. So it's best to move them down, and then you put them in the recovery position.
What is the recovery
position? Recovery position is lying on the left side. Usually, I think we should have a picture of that.
Yeah, I'm sure.
Yeah, so lying on the left side, exactly, with the legs, the left leg flexed upwards and the knees pointing upwards. With that positioning, you are trying to keep the baby or the child from rolling over or lying on the stomach.
Why is it important to have the baby or the person on the left side of the body?
Okay, so there's when someone has a seizure, there's a risk of vomiting. So I'm not done actually. So with the face as well, the face should be facing downwards, and then arms should be moved a bit upwards. This position is to help prevent the child from aspirating or swallowing vomiters into the airway instead of like the esophagus. So this position has been determined to be the safest position and aligns the body in such a way that it prevents this from happening. So the child could be in that position, and if possible, I know sometimes it can get very it causes a lot of anxiety or a lot of panic, but if possible, it would be helpful for the parents to be able to time the seizure for us, because that's what determines whether it was a simple one or
instead
a
of screaming Jesus, Jesus, they should be timing it.
Yeah, they should probably time how long it lasts for and which parts of the body was involved with that. And when you're putting the child on the floor, you need to make sure that there are no sharp objects around or something that could hurt the child. And then if there's any tight clothing that the child has on, you need to take it off. And then finally, you don't have to put anything in the mouth. So sometimes we put a spoon in the mouth
For
or
what?
other
For what?
things.
What are they
People,
putting
that's
spoons
what
in the
people
mouth?
do all the time, especially when they see gnashing or like foaming of the teeth. So that's not helpful, and that's not the time to actually put a drug in the mouth thinking that that's supposed to be helpful. So you don't have to do that. So if there's something in the mouth as well, you can take it off, because the child could swallow it, it could go to the wrong airway. So that's what a parent could do. Then the most important of all, immediately take the person to the hospital.
Okay.
Because that's where you're going to receive treatment for, because there could be like a repeat seizure, or if a seizure is an emergency. So even if it's aborted, we still need to find out why this person had a seizure. What are we going to do about this seizure?
What factors increase the risk of a child experiencing febrile seizure?
Okay, so we have it's been divided into minor factors and then the major factors. So our major factor is that, the febrile seizure actually occurs between 6 months to 5 years of age, with a peak being around 1 to 1.5 years. So if a child came at 7 years with a seizure and was febrile, we wouldn't term it to be a febrile seizure. So for a major factor, if the child has a less than 1 year of age, that's a risk factor. So every child below 1 year is at a risk of, developing a febrile seizure. Then we also have the fact that if you develop the seizure within 24 hours of having a temperature, that's a major risk factor, because that's going to occur again. And being a male already predisposes you to having febrile seizures.
Why?
So I can't really explain that, but it's a fact. So being a male, it's been shown that the number of between males and females is seen more in males, and we can't really, there's no reason as of now, but it's more in males than in females. And then also, if you have a family history of febrile seizures, like an older sibling had a febrile seizure, your parents had a febrile seizure when they were younger, or even a family history of epilepsy, these are all like risk factors that predisposes someone to developing a seizure, or also having the chance of a recurrence to be seen.
What are some of the long-term effects, or even short-term effects?
So really, the truth is, for a febrile seizure does not necessarily have a long-term effect, because it doesn't affect cognition in any way.
What is cognition?
So like how your brain functions, intellect. So let's put it that way, intellect. It doesn't really affect like how your brain functions in any way. So we don't really have long-term effects, but 5% of children with febrile seizures have been known to develop epilepsy, like in later life. But that's just, 5% is not just, but
it's a lot.
Yeah. So typically you wouldn't have any long-term complication. You get a febrile seizure, you are treated, and that's just it. You're fine. You can go home.
Okay. Are febrile seizures preventable?
No.
They're not.
Unfortunately, you can't prevent febrile seizures. So, because it comes with a temperature, people believe that, if I'm able to control the temperature, it's going to stop this person from getting a febrile seizure. But, it's been shown that the antipyretic, or what we use to bring the temperature down, what we usually use is paracetamol. It just sort of relieves the discomfort that the child is feeling, but it doesn't actually prevent the febrile seizure from occurring, or it can be used as a prophylaxis. Prophylaxis is, that, okay, I don't want my child to get a febrile seizure, so let me just start my child on like paracetamol. So unfortunately, like, one cannot prevent.
It doesn't work like that.
It doesn't work like that, so you can't really prevent your child from having a febrile seizure.
Should parents and caregivers take their children to the hospital anytime they suspect a febrile seizure?
Yes, you should. The main causes of a febrile seizure are some of the common infections we see in children. So like otitis media is infection of the ear, and then tonsillitis. So actually going to the daycare is a risk factor for like developing a febrile seizure, because
people are taking children to school very early.
Yes, and unfortunately their immune system is not as well developed as an older child, because they are yet to be exposed to a lot of things. So parents with children that age will attest to the fact that they always come home with a cold. They have some kind of catarrh, or ear infection, throat infection, tonsillitis. All those things actually are the ones that can cause. So if someone has a febrile seizure, I'll be interested in finding out, does this child have a throat infection or any upper respiratory tract infection, including the ear? There are other viruses that can actually cause, like a Shigella virus, which is seen in typhoid fever. So you need to think about all these things when you're you have to bring the person, because at the end of the day, if whatever is causing it is not treated, the child is just going to have it again. So child needs to come every single time they have a febrile seizure. And then also depending on how many febrile seizures they have, we can determine like over time, because the chance of you developing epilepsy increases with the type of seizure you have. If it's just a simple seizure, like a simple febrile seizure, you probably will not, you'll be fine. But if you're having a complex febrile seizure and you keep having it repeatedly, it means your chance of developing epilepsy would increase as well.
Should parents be concerned about any underlying illnesses that may trigger febrile seizures?
Yes, exactly. So that's what I mentioned about how the viral is mainly the viral infections that we see in children. So in terms of concern, it means that when they have it, you just need to bring them to the hospital. But after that, it's not like it's permanent, because you just treat it with medication. It could be bacterial, it could be viral. You just treat it with medication and then they are good to go, they are fine. So it's important for them to come, we treat, and then they can just get back to their normal lives.
How do you treat febrile seizures?
Okay, so we use anticonvulsants, or we know what a convulsion
Well,
is.
I may know, but my people may not know. So
Okay.
tell us.
So I think that people are familiar. I don't know what is said like other languages, but I know in Chi it's like they can say that extra cano. And we have, so what we have as a convulsion is the overt type that I described, because someone could have a seizure, and some of them are even subclinical. You wouldn't know the person is having a seizure until they are connected to a brain scan that's picking up that they have a seizure. So the convulsion is what we actually see. But so a seizure is made up of convulsion and non-convulsive, like a convulsive type and a non-convulsive.
Convulsion is the dramatic
the one
one.
that, the dramatic, like you see the person like moving and everything. Yeah, so that's about it.
Okay, and the treatments, medications.
So you use an anticonvulsant.
Okay.
So we have drugs that we actually use to treat this. So it has to be, this is not over the counter.
Okay.
It has to be prescribed by your physician. And depending on the type of seizure that you had, it will determine how long you're actually going to be on it for. For a simple seizure, when it resolves, we have a way of tapering down, and then we just take it off, or like they just stop the medication.
Okay.
But if this is someone that keeps having it recurrently, we might put the child on it just so that they don't have it, and then we will follow them up at our neurology clinic as well, just to make sure that, and be able to take them off when they need to go off.
Okay.
So that's not over the counter. You actually need to go to the hospital for your physician to prescribe it for you.
Okay, we'll talk about neurology shortly, but
Okay.
Is it safe to say that if you don't manage the child's temperature well, it may lead to a seizure?
So that's difficult to say, because as we mentioned, it's not preventable. So it's not a parent's fault if the child develops a febrile seizure, because ideally we have, I think most mothers have an idea what to do when their child has a fever. Everybody has Calpol or some form of paracetamol at home that they could give. Most people do tepid sponging. Its efficacy has not really been proven, because I mean, it's supposed to bring the temperature down.
So the towel on the head.
Yeah, the towel on the head, yeah.
Okay.
I mean, it's just going to bring it down shortly, but then it's going to come back, because whatever is causing it is still there. But at least this is the basic thing you do for a fever.
Okay.
You're just going to give the paracetamol, and then you take to the hospital as usual, because you have to be examined to show where the seizure, like where the fever is actually, what's causing the fever. Yeah, so that's basically, there's nothing you can do to prevent it. So you just need to manage your fever and then send to the hospital.
Okay. Can febrile seizures be a sign of something going on in the brain? I mean, neurological problems?
Okay, so yeah, I get it. So no. Actually, part of the criteria of calling something a febrile seizure, apart from the age range that we mentioned, that's 6 months to 5 years, and the temperature of greater than 38, there's also something that there should be no evidence of a CNS infection. A CNS is central nervous system, basically the brain and everything that surrounds it. So there shouldn't be any sign of once you have something going on in the brain, it doesn't qualify to be a febrile seizure. So I'll give an example. We have severe malaria. So in severe malaria, they can actually be unconscious, so they can have a seizure. And that's called a cerebral malaria. Of course, because of malaria, they will have a temperature, but you can't say that's a febrile seizure, because we've been able to find a CNS cause of it. So typically, when someone has an evidence of a CNS infection, we don't qualify that to be a febrile seizure. So when one has a febrile seizure, it doesn't speak to having a neurological problem. That's not to say that someone who has a neurological problem cannot develop a febrile seizure.
Okay, let's talk about some of the emotional and psychological impact of on a child who has experienced a seizure. How do parents help that child?
Okay, so because a febrile seizure occurs between 6 months to 5 years of age, some of the kids, depending on how old they are, may not really understand what they are going through. Because if it's an older child, because they are going to school, their friends are probably going to laugh at them that this child who is always falling, that can be a bit traumatic for an older child. But for a younger child, because they typically do not know what's going on, except for like a very smart child who is asking mommy, why am I in the hospital and all of that, I should think that the emotional and psychological impact is worse on the parents.
Okay.
Because most of the time it's very difficult for a parent to see a child. We all know what seizures are, and it's very scary. Even as a clinician, it's very scary. So it's more difficult on the parent than on the child.
And of course, in our environment, there are people are thinking about spirits and juju.
Yeah, I mean, exactly.
Something
is exactly, all those considerations. I think that for the parents, what helps is I'll put this on the clinicians that we should explain to parents what exactly is going on, reassure them, let them know, the long term, what the outlook is like. Let's just let them know that with a febrile seizure, you are not going to have intellect affected. The child is still going to be brilliant, and they are not probably going to develop epilepsy. So I think it's more of reassurance on the part of, the clinicians, helping the parents to understand what exactly is happening to the child. And if you have a very smart child, you should find a way of telling them that this is what happened to you, but you're going to be okay.
We're going to be okay. Yeah. On that happy note, I'd like to say thank you very much.
You're welcome.
Dr. Anna
thank you for having me.
It's a pleasure. Dr. Anna Foko-Buedu is a doctor at Kolebu Teaching Hospital, and she has been talking to us about febrile seizures. If you missed the conversation, where were you? Brushing your teeth? In the shower? Putting your clothes on? Don't worry. It will be on Facebook, GTV Ghana. Look for GTV Ghana. Follow it. Put a notification bell on so that anytime the videos pop up, you will get a small warning telling you that, hey, Charlie, we're about to go on air. All right? We're still in the BFS clinic because there's a conversation on nursing and midwifery at University of Ghana at 60. It's coming up in a short while. I feel like some doctor, some pocket doctor. Yeah.